Dizziness is one of the most common pregnancy symptoms. It is not usually a cause for concern, but for some women it can be severe. Dizziness affects many women during pregnancy, and it is often more of any annoyance than a sign of a severe problem. Still, it is important to consult a healthcare professional about any dizziness, especially if it is severe, causing fainting or make it difficult to work or do other daily activities. The question is dizziness normal? Early in pregnancy, an increase in hormones leads to the dilation of blood vessels, which may cause lightheadedness. This symptom may improve or worsen as the pregnancy progresses. Specifically, an increase in the pregnancy hormone human chorionic gonadotropin may cause dizziness as well as nausea that usually gets better by the end of the first trimester. However, the pregnancy progresses and the growing uterus crowds other organs. Some women find that dizziness gets worse. What are the causes of dizziness? Dizziness has many causes, including hormonal shifts, hunger, and problems with the heart or blood vessels. The most common causes during pregnancy include number 1, relaxed blood vessels. During pregnancy, the body produces hormones including one called relaxin, which cause blood vessels to dilate. The dilation increases the blood flow to the developing baby. However, the increase in blood flow also slows the return of blood to the woman's head, and this can cause dizziness during exertion or even when standing up quickly. Vasovagal syncope. Vasovagal syncope causes dizziness and fainting when the body, even very briefly, does not regulate blood pressure. It happens when blood pressure suddenly drops, often in response to anxiety or stress. Some women experience this for the first time during pregnancy due to the added stress and it places on the body. For example, a woman with a needle phobia may become dizzy when undergoing routine blood testing during pregnancy. Number 3. Hunger. Some women notice an increase in dizziness when they are hungry. During the second and third trimester of pregnancy, women need more calories to sustain their body and the fetus, which can lead to more frequent hunger. As blood glucose drops, dizziness may increase. Morning sickness. Morning sickness tends to involve nausea, vomiting, headache, or a combination of these symptoms. But some women also become dizzy. It can also affect women at different times of the day. In some cases, morning sickness gets worse when a woman is hungry or tired. Insulin resistance. Insulin helps the body digest glucose and turn it into energy. Even during a healthy pregnancy, the body cannot use insulin as effectively as it would at other times, and this causes mild insulin resistance. In some women, however, it leads to gestational diabetes. Some women with gestational diabetes experience dizziness when they are hungry, when their blood sugar is too high, or even diabetic medications causes their blood sugar to plummet. Exertion. Late in pregnancy, as the uterus expands, it puts pressure on many organs, including the lungs. This pressure can make it difficult for the lungs to expand fully when a woman breathes. While breathing may become more difficult, the body demands more oxygen during pregnancy. Therefore, pregnant women may feel dizzy when they exercise, breathe heavily, or get too hot. More serious health issues. Although dizziness is not an unexpected issue during pregnancy, in some women it signals a more serious problem such as high blood pressure, an infection, or a blood clot. Prevention. Pregnant women can reduce the risk of dizziness by using these tips. Number 1. Standing up slowly. Women who experience vasovagal syncope may be able to prevent sudden blood pressure drops by tightening the muscles in their legs. Exercising with care. While exercise is key for keeping the body and particularly the heart healthy during pregnancy, it is important to go slowly and increase the intensity only the advice of a doctor. Eating small meals throughout the day. Some women find that food rich in protein and other nutrients such as eggs and especially helpful. Drinking plenty of water, helping prevent dizziness, is just one of the many benefits of hydration. Keeping stress and anxiety at bay. Receiving support from loved ones, attending to mental health, and practicing deep breathing exercises can all help. Lying on the left side of the body. Lying on the left side keeps the expanded uterus from putting pressure on the liver and improves blood flow to the developing baby. Treatment. The approach to treating dizziness during pregnancy varies depending on the cause. Serious health problem, for example, will require treatment and monitoring in a hospital. In most other cases, a doctor will monitor symptoms and recommend at-home treatments. Some options include vitamin B6 and doxylamine for morning sickness. Use anti-nausea drugs if you feel more nausea and vomiting in this phase. Lifestyle and dietary changes to manage low blood sugar. Insulin or other medications for gestational diabetes if you have. Antibiotics if dizziness results from a bacterial infection. Possible complications. For the majority of pregnant women, the most dangerous complication of dizziness is falling and sustaining an injury. Dizziness can also make driving, heavy lifting, and some other tasks dangerous. A doctor can offer advice on strategies to manage dizziness and whether it is safe to continue driving. When to see a doctor? Dizziness is a common issue during pregnancy and often no cause for alarm. However, as it increases the risk of injury to the woman and baby, it is important to contact a healthcare professional and discuss the potential causes. Anyone who experiences any of these should receive emergency medical care. Severe shortness of breath, seizures, dizziness and fever. Any signs of premature labor such as contractions, water breaking or fluid come from vagina. So, this is all about dizziness. Share this information with your loved ones and be aware for your journey of pregnancy. Take care. Bye-bye.